Well, hello everyone. My name is Alasnag. I'm the chair of the scientific committee of the National Heart Forum here in Riyadh, Saudi Arabia. And it gives me great pleasure to introduce you to the past president of the Society of Cardiovascular Angiography and Interventions, Tim Henery. Tim, thank you for joining us in Riyadh.
So first of all, delighted to be here. My first time in Saudi Arabia. So this is really exciting, and I'm especially excited about this memorandum of understanding.
Yeah, so moving on to that, I know Sky in the last few years has really put significant effort in increasing the global footprint, Middle East, Asia, and so on. Talk to us a little bit about this strategy of Sky and why you're reaching beyond the borders of the United States.
Yeah, so I think the first point is that when I think about Sky, I think Sky represents interventional cardiologists, and then number two, interventional cardiology patients. So for us, it's really about taking care of interventional cardiology patients. And cardiology has become a very global thing. So treatments and care in Saudi Arabia is the same as treatments in the United States. And so this has changed dramatically over the last 10 to 15 years, where it's really become a global community. So therefore, it's natural for us to increase our global footprint, for sure.
And moving to Saudi Arabia more specifically, in the last few years, we've seen the collaboration increase. We are seeing Sky programs in Saudi Arabia, fellows courses, shock courses, and we've seen the membership increase. Saudi Arabia is now ranking number 4 of outside U.S. membership in Sky. So where do you think we're heading?
Well, so first of all, there are some countries in the world that have really strong societies, and then there are areas in the world really that this is a ripe for collaboration. And of course, you have played a major role in this development as well. But I think for us in this whole region, that it's a perfect opportunity, because I think what Sky wants to do is let's try to, as best we can, have standardized and uniform ways that we approach, whether it's cardiogenic shock or ST segment elevation, myocardial infarction, or valvular disease. How can we have standardize our treatments so that it's the best possible treatments, even though treatments might vary throughout the world? Sometimes better here than in the United States, sometimes not. And so I think this is our opportunity to say, what's the ideal standard of care, and to make that similar throughout the world.
So we really are looking forward to a memorandum of understanding with Sky. We're hoping that helps improve the care, as you mentioned, of our patients, and a little introspection looking at what we're currently delivering and where the areas of improvement are. Now, if we focus a little bit on shock, and I know this is an area of your expertise, and you were one of the authors of the shock document that came out, and the importance of that one was, for the first time in a very long time, the whole world is using the same language when we're talking about shock. So can you tell us a little bit about that statement?
Yeah, I think this is a perfect example of what we're talking about, because one of the problems with cardiogenic shock over the last 25 years is we really haven't made progress. One of the problems with not making progress is we weren't keeping track of results, and when we were keeping track of results, we describe it differently. So a patient might have a blood pressure of 90 and a wedge pressure of 25, and that's cardiogenic shock. Another patient might be having a cardiac arrest and doing CPR, and that's cardiogenic shock. They're not the same. And I think the original Sky Shock document, the idea was to standardize our language. And it's been wildly successful. I mean, it's now used throughout the world. And I think it really helps us because we're able to compare similar patients in clinical trials, but also in registries.
Well, I really want to thank you for your time, and thank you for flying over here. Really excited about the collaboration with the National Heart Center, and hoping to have another interview with you a year from now, and to kind of really go over the journey with Sky and the National Heart Center and see what we were able to achieve over the course of the year.
Well, I'm delighted to be here, and then there's so many opportunities and so much to do. So I want to personally thank you for your participation, because you have really been a bright light in terms of improving that collaboration around the world and through all international.
Thank you so much.